Have you ever had something feel a little off in your body? Maybe you brushed it off. Maybe you told yourself it's probably nothing. And most of the time it probably is, but not always. Because sometimes your body whispers before it screams. And the scariest part? A lot of serious health problems don't always start with dramatic pain or obvious symptoms. Sometimes they begin with small warning signs that people ignore every single day. That's why in this video, we're going over 7 warning signs your body should never ignore. Some of these may seem minor at first, but they can point to something much bigger happening beneath the surface. And trust me, number 1 is one of the most dangerous signs of all. 7. Unexplained weight loss. Let's start with something a lot of people don't take seriously. If you're losing weight without trying, that might sound like good news at first, but in some cases it can actually be a red flag. We're talking about weight loss that happens even though you haven't changed your diet, your workout routine, or your daily habits. Your body doesn't usually drop weight for no reason. Unexpected weight loss can sometimes be linked to things like thyroid problems, diabetes, digestive issues, liver disease, depression, or in some cases even cancer. Mayo Clinic notes that losing more than 5% of your body weight in 6 to 12 months without trying is worth getting checked. So if your clothes are suddenly fitting looser, people keep asking if you've been dieting, and you know you haven't been doing anything different. Don't just celebrate it, pay attention to it, because when your body starts changing without your permission, it may be trying to tell you something important. 6. Shortness of breath. Now this one is a huge one. Feeling out of breath after running, climbing stairs, or doing intense exercise, that's normal. But if you're getting short of breath doing basic things, like walking across the room, talking, or simply lying down, that is not something to ignore. Shortness of breath can be caused by asthma, infections, pneumonia, lung disease, anxiety, blood clots, or heart-related problems. And if it comes on suddenly or feels severe, it may need urgent attention. A lot of people make the mistake of waiting too long. They say things like, "It's probably just stress. I'm just tired. I probably didn't sleep enough." But your body needs oxygen to function properly. And when breathing suddenly becomes difficult, your body is not being dramatic. It's sending a warning. So if you ever feel like your breathing isn't normal, especially if it's sudden, unusual, or getting worse, take it seriously. 5. Changes in your bathroom habits. This is one of those topics people avoid talking about, but it matters more than you think. Your bowel habits can actually reveal a lot about what's happening inside your body. If you suddenly notice persistent constipation, ongoing diarrhea, black stools, bloody stools, unusual stomach pain, or major changes in how often you go, don't just ignore it and hope it goes away. Persistent or unusual bowel changes can sometimes point to infections, inflammatory bowel disease, bleeding, or other gastrointestinal problems. A lot of people normalize symptoms for way too long. They'll say, "My stomach's been weird for weeks," or "I thought it was just something I ate." And yes, sometimes it is. But when a change is unusual for you or keeps happening over and over, your body could be trying to wave a red flag. The truth is, what's normal is different for everyone. But what's not normal is when your body suddenly starts acting very differently and doesn't go back. That's something worth paying attention to. 4. A fever that won't go away. Most fevers are your body doing exactly what it's supposed to do and fighting off an infection. But there's a big difference between a mild fever for a day and a fever that stays around, keeps coming back, or gets very high. A persistent fever can sometimes point to infections that need treatment, and in some cases, it may signal something more serious. Mayo Clinic advises contacting a healthcare professional if a fever reaches 103 degrees, 39.4 degrees Celsius, or lasts more than 3 days. And here's what makes this tricky. A lot of people try to push through it. They keep going to work. They keep pretending they're fine. They keep taking medicine just to mask the symptom. But fever is not the real problem. It's the signal. Your body is saying, "Hey, something is happening in here." And if that message keeps repeating itself, you shouldn't keep ignoring it. 3. Feeling full too quickly. This one surprises a lot of people. If you sit down to eat and suddenly feel full after just a few bites, especially if that's not normal for you, it may seem harmless, but if it keeps happening, it can actually be a warning sign. This is called early satiety, and it can happen alongside symptoms like nausea, bloating, vomiting, stomach discomfort, or unexplained weight loss. Mayo Clinic says it can be linked to issues like reflux, ulcers, and other digestive problems, and occasionally more serious conditions. A lot of people ignore this because it doesn't feel dramatic. It's not sharp pain. It's not a scary emergency symptom. It's just weird. And that's exactly why it gets missed. But your appetite can tell you a lot about your health. And when your body suddenly stops handling food the way it used to, that's not something to brush off forever. 2. Sudden vision changes or flashes of light. This one can be terrifying, and it can also be time sensitive. If you ever suddenly see bright flashes of light, new floaters, a shadow or curtain over your vision, or a sudden loss of vision, do not ignore it. Sometimes flashes of light can happen with migraines, but in other cases they can signal a serious eye problem like retinal detachment, which needs urgent evaluation to help protect vision. A lot of people wait because they assume it will go away. They think, maybe I'm just tired. Maybe I looked at a screen too long. Maybe it's nothing. But your eyes are not something you want to gamble with. Vision changes that happen suddenly are not the kind of symptom you wait and see on for too long. Because when it comes to eyesight, timing matters. 1. Chest pain, pressure, or that something's not right feeling. And now for the warning sign you should never ignore. Chest pain. But here's what makes this dangerous. It doesn't always feel like the dramatic movie version where someone grabs their chest and collapses. Sometimes it's pressure, sometimes it's tightness, sometimes it feels like burning, squeezing, heaviness, or discomfort that comes and goes. And sometimes, especially in women, it can show up as unusual fatigue, nausea, shortness of breath, or just a strange feeling that something isn't right. Cleveland Clinic notes that early heart attack symptoms can be subtle and may appear hours, days, or even weeks beforehand. This is where people get into trouble because they wait. They tell themselves it's gas. They tell themselves it's anxiety. They tell themselves it's stress. And yes, sometimes it is, but if it's your heart, waiting can be deadly. And chest-related symptoms are not the only emergency signs people ignore. If you ever notice sudden face drooping, arm weakness, slurred speech, sudden confusion, or sudden trouble seeing or walking, those can be signs of a stroke and need immediate emergency care. The fast warning signs, face, arm, speech, time, are especially important to remember. So if your body is sending a message that feels serious, don't try to be tough. Don't try to sleep it off. Don't wait for it to become obvious. Because sometimes the most dangerous symptom is the one people talk themselves out of taking seriously. Final message. Your body is smarter than you think. It gives warnings. It sends signals. It tries to get your attention long before something becomes a full-blown emergency. The problem is, most people ignore the early signs. They stay busy. They stay distracted. They keep saying, I'll deal with it later. But later doesn't always come with a second chance. So if something feels off, if a symptom is new, unusual, severe, or not going away, listen to your body. It might just be trying to protect you. And if this video helped you, make sure you pay attention to the people around you too, because sometimes knowing these warning signs could help save someone else's life. Take care of your body, because you only get one.